Hi guys, myself Dr.Sonali. Last time we had discussed about the attack, that is the myocardial infarction. Today we are going to discuss about angina. The characteristics is same, that is the chest pain, but we have to differentiate it from MI. This disease is called as angina pectoris. So understand what is angina. Angina means it is a sudden obtrusive precordial pain associated with ischemia. It is characterized by imbalance between the myocardial oxygen supply and myocardial oxygen demand. So this is a definition. Broadly, the angina is divided into three types. First is the stable angina, classical angina or a typical angina. हा जो angina असतो ना, तुम्हाला पेन होणार, छातीमध्ये दुखणार तुमच्या, पण दॅट विल बी ड्यू टू 3 लक्षात ठेवा तुम्ही त्याच्यामध्ये. फर्स्ट इज एक्झर्शन, एक्झरसाइज अँड इटिंग ऑइली जंक फूड. ह्यामुळे म्हणजे मोस्टली तर गॅसच असतो, पण आपल्याला छातीत दुखायला लागलं की सामान्य माणूस घाबरून जातो की अटॅक तर नसेल. तर ह्या 3मुळे जर छातीत दुखत असेल तर तो जो एंजायना असतो तो स्टेबल एंजायना म्हणतो आम्ही त्याला. अँड तो जो एंजायना असतो तो नायट्रेट्सने लगेच बरं होतो. पण जो दुसरा टाईपचा एंजायना असतो म्हणजे तुम्ही जो रेस्टमध्ये पण छातीत दुखतं तो द सेकंड एंजायना, इट इज कॉल्ड ॲज अ प्रिन्समेटल एंजायना और अनस्टेबल एंजायना. इन दिस द पेशंट गेट्स द चेस्ट पेन even at rest, and it is not relieved by nitrates. Okay, so this type of angina is called as an unstable angina or a Prinzmetal angina. Now the third type of angina is called as a post infarction angina, post MI, म्हणजे ज्याला अटॅक येऊन गेला आहे पण मल्टिपल वेसल्स इन्व्हॉल्ड आहे, मल्टिपल वेसल्स एथेरोस्क्लेरोसिस झालं आहे, तर तो जो एंजायना असतो दॅट इज कॉल्ड एज अ पोस्ट इन्फ्रॅक्शन एंजायना. ह्याच्यामध्ये आपल्याला एन्जिओग्राफी करावी लागते. मोस्टली काय पेशंट्सला चेस्ट पेननंतर एन्जिओग्राफी करायची किंवा अटॅक आल्यानंतर एन्जिओग्राफी सजेस्ट केलेली जाते. तर त्यांचे मल्टिपल वेसल्स इन्व्हॉल्ड असतात, त्यासाठी आपण एन्जिओग्राफी करतो, त्यामुळे ते वेसल्स पण क्लिअर होतात. म्हणजे इट इज फॉर थेरापेटिक ॲज वेल एज डायग्नोस्टिक यूज, दिस टाईप ऑफ एन्जिओग्राफी ऑफ पोस्ट इन्फ्रॅक्शन एंजायना. So these are the types of angina. Now we will study what are the drugs which are used in the treatment of angina. The main drug which is used in the treatment of angina is called as the nitrates. And the nitrates, there are two types of nitrates, inorganic nitrates and organic nitrates. So first is the inorganic nitrate, that is the sodium nitrate. हा जो सोडियम नायट्रेट ड्रग आहे हा आपण सायनाइड पॉइझनिंगमध्ये वापरतो. सायनाइड पॉइझनिंगचे केसेस असतात मोस्टली इन कंपनीज आणि त्याच्यामध्ये होतात. तर दिस टाईप ऑफ सोडियम नायट्रेट्स वी आर युझिंग इन सायनाइड पॉइझनिंग. द सेकंड दॅट इज द ऑर्गॅनिक नायट्रेट्स. दे आर डिवायडेड इंटू शॉर्ट ॲक्टिंग अँड लॉंग ॲक्टिंग. शॉर्ट ॲक्टिंग जो आहे त्याला म्हणतो आपण ग्लिसरीन ट्रायनायट्रेट. हे जे ग्लिसरीन ट्रायनायट्रेट आहे त्याचे आपल्याला पॅचेस अवेलेबल आहे, स्प्रे अवेलेबल आहे, त्यानंतर ऑइंटमेंट अवेलेबल आहे, IV देऊ शकतो आपण, टॅबलेट्स अवेलेबल आहे. आणि दुसरा लॉंग ॲक्टिंग दॅट इज कॉल्ड एज द आयसोसॉर्बिट डायनायट्रेट, जी आपण सॉर्बिट्रेटची गोळी देतो 10 mg किंवा 5 mg. घरी जर तुमच्या छातीत दुखत असलं आणि तुम्ही क्रॉनिक हायपरटेन्शनचे पेशंट असणार तर सॉर्बिट्रेट नावाची गोळी आपल्याला घरी पाहिजेच, बिकॉज इट अरेस्ट द चेस्ट पेन्स व्हेरी इझिली. ओके, सो दिस वॉज अबाउट नायट्रेट्स. तर हे नायट्रेट्स त्यांचं मेकॅनिझम ऑफ ॲक्शन काय आहे ते आपण बघूया. ते कसं चेस्ट पेन हे करतात, रिलीव्ह करतात. तर when these nitrates are given to a patient of ischemia, then the nitrate is converted into nitrous oxide in the liver, and this nitrous oxide now activate the cyclic GMP. This cyclic GMP now does not allow the actin myosin combination, and if the actin myosin combination doesn't take place, then there is a relaxation of blood vessels. Okay, the actomyosin complex doesn't happen, then there will be relaxation of, and due to relaxation of blood vessel, what will happen? The preload will be reduced in the veins, the afterload will be reduced in the arteries, and the demand of heart will be reduced. Okay, like this way, by dilatation of the blood vessels, the nitrates reduces the chest pain. So this is the mechanism of action. But when these nitrates dilates the coronary blood vessels, simultaneously they also dilates the ocular blood vessels, cerebral blood vessels, and they causes this cerebral blood vessel, they causes a severe headache. After this, if you are given a sublingual nitrate to a patient of angina, it should be spitted between 2 to 3 minutes. Otherwise, it is going to cause hypotension and giddiness because of relaxation of the vessels. So all the action is on the vascular system, that is the vessels. When we talk about ocular blood vessels, the ocular blood vessels, they At the they if the patient is suffering from glaucoma, they will precipitate glaucoma. So if the patient, your hypertensive patient is of glaucoma, you have to take care of the patient. Then about the when we go towards lungs, what in the lungs, the pulmonary blood vessels will be relaxed. There will be shift of blood vessels from the pulmonary vasculature to the systemic vasculature. So there will be relieving of the paroxysmal nocturnal dyspnea, which is associated with congestive cardiac failure. So this was the action in the action of nitrates on the lungs. Action of nitrates on the, these nitrates also, see, there are some cases of asthma which are resistant cases of asthma मध्ये nitrates कामा येतात. So nitrates also relieves the resistant cases of bronchial asthma. They also relieves the ureteric colic, biliary colic, and this thing, intestinal colic. So this they relieve the colic also, nitrates in some cases. So these are the actions of nitrates. They are first, the nitrates are the gold standard treatment for the angina, no doubt. First they are using in angina pectoris. Okay, so in which cases, when the see, there are two types of angina we studied: stable and unstable. Stable is due to 3 E's: exertion, exercise, and eating oily junk food. And in unstable, the patient is having chest pain even during rest. अनस्टेबल त्या पेन असं असतं की पेशंट आहे ना, पूर्ण आपली मुठ्ठी आपली स्टर्नमजवळ लावून असा दाबतो, दोन्ही हात त्याच्या बेस ऑफ लंग्सला असतात आणि आतमधनं असं पूर्ण असा प्रेशर येतं आतमधनं आणि चेस्ट टाईटनेस जाणवते. दिस टाईप ऑफ पेन, इट इज द एंजायनल पेन. And how you are going to diagnose whether it is a functional or organic? If the pain is organic, that is due to 3 E's, it will be relieved by nitrates. But if the pain is functional, due to atherosclerotic plaque, it won't be relieved by nitrate. Okay, so it's functional. So along with nitrates, we have to give heparin, that is the anticoagulant, this thing, or low molecular weight heparin also. So this is the differentiation. And when we talk about organic nitrates, one nitrate is called as sodium nitrate. This sodium nitrate, we are using it in the cases of cyanide poisoning. So now what happened in cyanide poisoning? The hemoglobin is converted into methemoglobin, and this methemoglobin, it converts the toxic cyanide ions into non-toxic ones. So okay, but this cyanide ions, they have a high molecular weight, so they are very difficult to excrete. So they required, along with sodium nitrate, we also use sodium thiosulfate. Sodium thiosulfate is also used. So sulfur, this sulfur we are getting from sodium thiosulfate for the excretion of the cyanide ion. So this was about cyanide poisoning and sodium nitrate. And this now we will talk about the investigations. How will you diagnose? This unstable angina is promptly diagnosed via ECG. There might be ST elevation, there might be ST depression, okay, and T wave inversion sometimes. So this is very easy to diagnose on the basis of ECG. But in the resistant cases, in the cases post infection cases where multiple vessels are involved, there we need a coronary angiography. So 2D echography, we can diagnose by 2D echo also, ECG also. Then if there is a cardiomegaly, then chest X-ray also. Then various investigations are, these are the basic investigations. Angiography is diagnostic as well as for therapeutic purpose. Now we will see other drugs. So in unstable angina, what are the other drugs which we are using? We also use beta blockers. Beta blockers like propranolol, metoprolol, atenolol. So what the beta blockers do? There are 3 types of beta receptors: beta 1, beta 2, beta 3. Beta 1 in heart, beta 2 in blood vessels, and beta 3 in adipose tissues. Okay. So these beta blockers, they block the beta 1 receptors of the heart, and by blocking the beta 1 receptors of the heart, there will be negative inotropic, negative chronotropic, negative demographic effect of the heart. So there will be reduced heart rate, reduced force of conduction, reduced force of myocardial contractility, reduced conduction, that is the conduction effect. So by reducing this, all the 3 effects, there will be decrease in the myocardial oxygen supply and uh, the palpitations, chest pain will be reduced. Now also we can use calcium channel blockers. Calcium channel blockers like diltiazem, verapamil, amlodipine. Okay, this can be used. What happens when the calcium enters the cardiac cell? The cardiac cells, the depolarization rate increases. But in calcium channel blockers, they block the calcium channels, and there is reducing the depolarization rate. By reducing the depolarization rate, there will be reducing in the myocardial contractility, heart rate, and also reduce in the conduction effect. So this was about beta blockers and calcium channel blockers. Now the next drug which we are using for this angina, they are the unstable angina mostly. They are the potassium channel openers. That is the nicorandil. What this potassium? They open the potassium channels and they excrete the excess of potassium from the cardiac cell to outside. Okay, so what will happen? There will be reducing in the depolarization rate. If there is a decrease in the depolarization rate, there will be decrease in the myocardial contractility. If decrease in the force of conduction, decrease in the this thing heart rate. Negative inotropic, negative chronotropic, and negative dromotropic effect by opening the potassium channels. So obviously there will be relief of this thing, chest pain, and the heart will demand less blood. The demand which was increased in the angina, that will be reduced. Why it happened? Because of decrease in the myocardial supply and increase in the myocardial oxygen demand. हार्टचा ब्लडचा जो डिमांड असतो तो वाढतो, म्हणून angina होतो. So this will be there will be relief. We also use antiplatelet agents like aspirin, clopidogrel. What they do, there is this aspirin, they inhibit the enzyme thromboxane A2. Thromboxane A2 is a platelet aggregator. If this enzyme reduces the platelet aggregation, so there will be clearance of the blood vessels. Okay, the clots and the platelet aggregated, which are the atherosclerotic plaques, will be reduced by this aspirin and clopidogrel. Then we also use ranolazine, trimetazidine, then evabrad. Okay, this type of drugs in cases of unstable angina. So this was about angina. Now we will study that how this angina can be prevented. See, first, the angina can be prevented by lifestyle modification. We have to modify our lifestyle. So we have to daily do exercises which are not exertional. So yes, and one more thing I forgot. In the unstable angina, we also do the stress test. That is the patient's heart rate, we have to raise up to 250 or 220 per minute, and we have to take down the ECG by all 12 leads. So he test पण आपण करतो, stress test. So lifestyle modification, then we have to change our faulty diet. We have to eat fiber containing food and low cholesterol. The main cause of the atherosclerosis is what last time in last video I had explained about atherosclerosis. So why atherosclerosis occurs? It because of the hyperlipidemia. So we have to avoid the oily food which causes hyperlipidemia. We have to avoid groundnut oil. Okay, so cod liver oil is very good for heart, so fish is recommended. So changing in the lifestyle modification, changing in the dietary habits will prevent this such things. Exertion नाही करायचं आहे, एक्सरसाइज पण आपल्याला मॉडरेट करायचे आहे, आणि eating habits, oily and junk food we have to avoid. So this was about angina. Thank you so much.